the Schedule 3N, which is like a whole other category. And it's a barbiturate, so it's related to like phenobarbital, but it's an overdose, and it's also usually combined with other drugs to either reduce muscle spasms or help with relaxation. And so you do have to have a DEA license at least to use euthanasia solution. But one of the options from the Virginia Department of Health was you could elect just not to dispense any. The second option was you can be exempt from having to report directly through the prescription monitoring program if at most you dispense 7 days worth for any patient from the hospital. So let's say Fluffy injured themselves. They come in, I assess them. I determine that tramadol, which is an oral pain medication, is the most appropriate pain medication. And I can then send home 7 days worth. And I don't have to report it. The patient then has to come back a week later to be reassessed. And if I think that at that point it's more of a chronic issue and the continued use of tramadol is appropriate, then I write a prescription and they get it filled at a human pharmacy. And at that point, I still don't have to report it because the human pharmacy is going to report it in the prescription monitoring program. And at this point, we can, I think, dispense up to 3 months worth of, and realistically, tramadol is the primary one that we're talking about. And we can dispense up to 3 months of tramadol with one refill, and then they have to have an exam every 6 months to ensure that they still do need the pain medication. And this way, we don't have to worry about the hubbub of the prescription monitoring program, but chronic use of oral opioids is still monitored. And then the last option you could choose was to participate in the prescription monitoring program and basically dispense as much opioid as you want from your hospital. So I elected option 2, as did I mandate that all of my associates. So at our hospital, that's the policy. Like if your patient injures themselves and we feel that an opioid pain medication is the most appropriate, then we are going to dispense no more than 7 days. And then if you need more, you have to come back for a refill, like through a written prescription. The same idea applies to gabapentin, even though it's not controlled. You can only dispense 7 days worth from your hospital. You do not have to do the mandatory recheck after 7 days. You can then write a script for the rest. But that way, that is also being monitored. And the primary reason for doing this, again, is not to make sure there aren't like a bunch of junky dogs. It's to make sure that the owners are not taking the medication. And it does happen, unfortunately. It's very uncommon. I've only personally known / suspected of a couple over the last years. And I did have one client who I was sending home tramadol. This was years ago. And they informed me that they were a recovering opioid or painkiller addict. And I immediately said, all right, well, let's do a different drug. And they wanted to keep that drug. And I think in part just to kind of like test themselves. But basically what we had to do is we had to like hermetically seal the bottle, write on tape how many pills were in there. And then I called the husband and informed him that, you know, this is the drug we're dispensing. It has been approved by your significant other. These are how many pills are in there, so that when the owner got home, they could then count the medication and ensure that nothing had been taken. I mean, personally, I would just like have used a different drug if it was me, just because, you know, I wouldn't want the temptation. But, you know, we accommodate. So for people that are taking their animals' drugs, right? And again, we're mostly talking about tramadol. So people that are taking their animals' tramadol, the things we would see before this started were, you know, you'd send home a 90-day supply and they'd call a month later and ask for more. Or you would send home a 90-day supply, because that's basically the most that we would send out, right? So anywhere between 30 to 90 days if we're using it chronically. And they'd call back 60 days later. And the next time they'd call back 30 days later. And the only way that you would really be able to tell is because every prescription refill request that comes into the hospital has to be approved by a doctor. But sometimes the doctors are not going back and looking at like every single refill that they've done for that patient, which is a mandatory requirement in my hospital. And using electronic medical records is really easy because you just like click on the little tab that says prescriptions and then it comes up. And that way you can tell, all right, well, this person is really frequently requesting tramadol more so and using it more. So then you got to call and find out, have you changed the dose? And if they say no, then it becomes like a very awkward conversation of, why are you running out of the medication so quickly? And usually it ends up in us just saying, okay, well, we need to change medications. And there have been reports of some people like vet shopping to try and get different tramadols dispensed from different veterinarians. I don't believe that I've ever been involved in that. To be honest, I guess I could have, but nothing super shady that I saw that I thought people were coming to me just to get a pain medication. And I have had some people ask for things like Tylenol 3 or which is the Tylenol with codeine, which I don't use very often. Some veterinarians do use, but I don't think I've ever actually prescribed it. And so I don't know if that was them just knowing drugs names or actually trying to get the medication for themselves. But it's just really sad because, people become addicted and then they try and find different ways to acquire the drug, and it ends up, that they're using their animal. And I have heard stories of animals being injured so that people can then go to the veterinarian to request tramadol. And luckily I've never seen that, because that is just horrific in my mind. But that's one of the ways in which the opioid epidemic has affected veterinarians. And to kind of prevent that from happening, we write the prescription. And so we write it, and the pharmacy controls when you can refill it, right? And pharmacies don't really give you a lot of leeway. So if it's too early, it's too early. And, they're not, if the client calls us to try and get another prescription, it's being monitored, so it can't really be filled at a different pharmacy. Plus, we're double checking to make sure that, if we just wrote one, and they're calling like a month later, that they really need one. The other aspect of pain medications, like opioid pain medications in veterinary medicine, is we had for a while a pretty severe shortage of injectable pain medications like hydromorphone and morphine and methadone. And remember, those are Schedule 2, right? So those are the ones that you have to write a 222 form. And most of the time, if you use an intermediary service for ordering, you submit it online and then you get it like within a day or 3. But with the 222 forms, it takes a while because we send it certified mail, so we know that they get it. And it can sometimes take a solid week to get it back. And it was probably last winter when, Virginia kind of said, okay, enough is enough. Like, we have to do something. And they kind of shut down release of most, if not all, Schedule 2 medications. And what happens is that, a company is no longer distributing and there's a shortage. Well, the first thing they're going to do is cut out their distribution to veterinary patients, because if there's a shortage of medicine, the most important is that they go to humans to be used first. And I'm not disagreeing with that rationale. As much as I love my patients, if it's a life-saving drug and there's a shortage of it, it should go to the humans first. But it wasn't that they couldn't make it. It was that the government was suppressing the release of it. And I, to be honest, don't like it because it was a nationwide thing. So I think it was a federally kind of orchestrated issue. But there was a solid 4 to 6 months where, we couldn't get our hands on hydromorphone, which was our preferred injectable pain medication for surgery for dogs. And buprenorphine, which is a Schedule 3, we were able to get. But buprenorphine is like 5 times the cost of hydromorphone. And so it really was not cost effective for like big dogs because, it affects the cost then that is passed on to the clients, because if our medications that we're charging for all of a sudden are 5 times more expensive, we can't realistically continue to use the same pricing scheme. And so there was a solid 3 months where like I would fill out a 222 form, send it in, and then they're good, I think, for like 30 days. And then I guess it would have been smart if I had like a reminder on my phone, but what would happen inevitably is I would get the 222 form back saying that it's expired, because there were so many veterinarians in line for injectable pain medications, and they didn't keep your place in line. So if you applied with your 222 form for a bottle of hydromorphone and you were like almost next and then it expired, you didn't get to stay in that line. You had to like go to the back of the line and then wait again and start over. And so I just stopped after a couple months because it was just so frustrating and disheartening. And then eventually when they started to allow more in circulation, now we are able to get it. But unfortunately, it does, in that case, negatively affect our patients, because in certain instances, hydromorphone, which is a morphine relative, would have been more beneficial than buprenorphine. And buprenorphine does a pretty good job with pain control. But like I said, it then is a higher cost, which is transferred to the client. And in some instances, we may not consider it to provide as good of a pain control. So that is just kind of like little glimpse into how things like that actually do affect veterinarians and their patients. And other things to think about is when, I think this was last summer or the summer before, Virginia was trying to pass a law that said that if you dispense buprenorphine, you have to, which is another injectable pain medication, injectable opioid, you have to dispense the reversal agent, naloxone, with it. And I think they actually passed it, and then veterinarians were like, whoa, wait a minute, like that is way too expensive for us, because every time we buy buprenorphine, or if we send, because in cats you can actually use it orally and it has pretty good absorption. So if we send home buprenorphine as like a post-operative pain medication for our cats, we have to then also dispense naloxone, which is just crazy expensive for clients. So luckily, the Virginia Veterinary Medical Association, or VVMA, is one of its jobs is kind of like keep a watch on those sorts of things. And they were able to alert veterinarians, all members of the VVMA, to then contribute our rationale as to why that was a terrible idea. And they did amend it. Like there is now an exemption for veterinarians so that we don't have to dispense naloxone at the same time. And for things like buprenorphine, especially because we can only dispense up to 7 days worth, the cat doses are like so tiny, and realistically generally only dispense 3 to 5 days worth, that it would be very hard for a human to overdose on the small doses that are sent home, even if they like took all at once. So I think that was a great example of veterinarians kind of rallying together to come to their own defense. And that just kind of, I think, is another eye-opener about, hey, a lot of times when we make these rules and regulations with humans in mind, that's great, but we need to also think about, hey, are those medications or procedures or anything that we also use in animals, in which case maybe we need to take a step back and see if there are exemptions that need to be applied. The other thing that has changed, and this is the last thing that I'll talk about, is for every controlled substance that we dispense, we have to send home now like an opioid handout. So basically, every time I read it, I just kind of like harness my inner counselor from that counselor guy from South Park. I can't think of his name, where he's like, drugs are bad. Okay. So it basically says, don't take your pet's drugs. These are the side effects of opioids. This is how you dispose of it. And so we have to give it to clients every time just so that they're aware. I honestly, we give it to them and we go over it, and I don't think anybody ever reads it. But at least we're providing them with information that they may want to peruse at their own leisure. So I hope that kind of answers questions you may have never had about controlled substances in veterinary medicine, as well as how the opioid shortage has actually affected us and our patients. And if you have any questions, as always, just hit us up on info@independenthillvet.com. I think you can post comments or questions on the host sites that we use for the podcast. But like I said, at another time, we'll talk about marijuana and CBD oil and veterinary patients, because that to me is super fascinating. I mean, marijuana in veterinary patients really has no actual effect because they have too many side effects, but CBD oil and hemp oil can actually be very beneficial. So I will talk about that another time. I think that about wraps it up. As always, thank you for listening to this installment of Vetsplaining. I hope you enjoyed your time with me and ideally learned at least one new thing for the day. If you have any questions or suggestions for future topics, feel free to leave a comment below or email info@independenthillvet.com and put podcast topic or podcast comment in the subject line. Until next time.